morning, and welcome to the 2024 HIDA Prevention Summit. I bring you greetings from President Biden and Vice President Harris, who are both big supporters of the HIDA program because they've seen it in action and they know its value. They also know that stopping traffickers and saving lives are two sides of the same coin. That's why President Biden has declared October as National Prevention Month, a time when we focus on preventing youth substance use and helping young people build brighter futures. So I want to start by thanking you for your commitment to this mission. Whether you're a HIDA task force member, a resource officer, a prevention leader, an educator, a social worker, or a psychologist, or a parent, or a representative of the Community Coalition, your involvement in preventing substance use is saving lives in your community. And when it comes to drug policy and the opioid crisis, saving lives is our North Star. When the President and Vice President came into office, the country was facing devastating increases in overdose deaths, more than 30% in a single year. This means empty seats at the dinner table, families torn apart, and communities devastated. So they made an intentional choice to take on this crisis in partnership with advocates for change, including all of you taking part today. And they hit the ground running to deliver the change we need. And thanks to that work, the opioid crisis looks a lot different than it did in January of 2021. And let me explain what I mean. Naloxone or Narcan is more accessible than ever. Treatment is more available than ever before. We're catching record amounts of fentanyl at the border, and we're going after the drug trafficking profits that are fueling this crisis. And we're building a recovery-ready nation that helps people get their lives back and contribute to their communities. And we're reaching more youth, more educators, and more parents about the dangers of fentanyl and the life-saving power of naloxone. Our HIDAs are one of the best tools to stop traffickers and keep young people safe. Through HIDA, we're in all 50 states and U.S. territories, and we're bringing together law enforcement and community leaders at all levels, and we're taking drugs off the streets. Now, in 2023 alone, folks, HIDA helped disrupt and dismantle more than 3,000 drug trafficking and money laundering organizations. It seized more than $17 billion of illegal drugs, $17 billion, including more than 9,000 kilograms and more than 117 million pills of fentanyl, and confiscated more than $640 million from drug traffickers. Now that's phenomenal work. As I mentioned, public health is the other side of the coin. And we're working hard to put more naloxone or Narcan into people's hands so we don't miss a single chance to save a life. And that's why earlier this year, we launched the White House Challenge to Save Lives from Overdose, which is calling on organizations and businesses, big and small, public and private, across the country to help ensure that all communities are ready to use this life-saving tool to reduce opioid deaths. Now, we already have commitments from airlines like Delta and Southwest, entertainment companies, labor work sites, local agencies like the Chicago Department of Aviation, school districts like the Los Angeles Unified School District and Atlanta Public Schools, state and local transit systems in places like Boston and Philly and DC and San Francisco and New Jersey and so many more. Major League Baseball has signed up. Tribal communities and so many more are participating. And this is saving lives. You know, since the LA started keeping naloxone on their school grounds, the district has administered this medication 50 times. That's 50. 50 students still sitting in class each day, still at dinner table each night, and still having a chance at recovery and a bright future, all because of naloxone. So I want to see naloxone in public places, right there on the wall next to the fire extinguisher and the AED machine. Now, folks, we can make this happen. And all of this work, from law enforcement to public health, is making a difference. You know, overdose deaths are down 10% over last year. And in fact, for opioids like fentanyl, it's 12.5%. That means we're saving a life every hour around the clock, every single day. So think about this, from a 30% increase to a 10% decrease. And it's thanks in part to the work that you are doing each and every single day. So thank you. You know, we got to keep the momentum going. And that's why today's summit is so important. We all know that preventing substance use in the first place is our best strategy to prevent overdoses in the long run. And it's more important than ever because drug use is more dangerous than ever. Drugs now can be bought by clicking a few buttons on a smartphone, and many young people are buying what they think is Adderall or Xanax or oxycodone. But you know that DEA reports that 7 out of 10 of those pills bought online actually contain potentially lethal doses of fentanyl. And in 2022, we lost nearly 100 youth a month to overdose. That's 3 each and every day. Think about that. And all of these deaths were preventable. So we gotta equip young people with the tools that they need to make healthy choices and build bright futures. And we must reach them where they spend most of their time, in school. And that's why ONDCP and the Department of Education have created tools for educators to recognize the signs of substance use and how to respond to an overdose, which you can find it at ed.gov/opioids. That's ed.gov/opioids. And that's why we continue to fund the 750 drug-free community coalitions across 50 states in the U.S. and territories. And right now, 75 million Americans live in an area that is served by a DFC coalition. And they bring together all sectors of the community to focus on this life-saving mission. Look, we know that delaying the start of substance use among young people, even by 1 year, can decrease substance use for the rest of their lives. And the same is true for warning them about the dangers of illicit fentanyl and the life-saving power of naloxone, which we're now doing through our Real Deal on Fentanyl social media campaign. See, the bottom line is this: every young person we reach, it does make a difference. And that's why the HIDTA prevention strategy is so important. It's got tools you can start using right now to reach youth, including guides on how to communicate about substance use prevention, talking with youth about prevention, and developing a comprehensive community-based prevention strategy, and so much more. I want to thank Jeff Beeson and the Washington-Baltimore HIDTA for supporting this summit and this important work. And thank you to Shannon Kelly and Jamie Delano for all of your work here at ONDCP, both in leading the HIDTA program and supporting this summit. As I said earlier, this crisis looks a lot different than it did 3.5 years ago. We are turning the ship around. We're saving a life every hour of every day. But there is still so much more to do. And we need you. We need you and everyone on the team to keep working at it and doing our mission. And I want you to remember that you can be the difference in people's lives. You can use the HIDTA prevention strategy in your community. You can carry naloxone. You can join the White House Challenge that I talked about. And you can be a part of the local coalition and work with local schools. And together, we will help young people have bright futures, and we will beat this crisis. As President Biden often says, we are the United States of America. There's nothing beyond our capacity when we act together. So thank you. Thank you for being on the team.
Wonderful. Thank you, Dr. Gupta, for those remarks. At this time, we are going to close out this particular session, and we will see all of you at the morning keynote session, and we'll talk with Dr. Christina Bethel. See you over there.